Hello and welcome to episode 61 of the TRUUMAN Podcast, the podcast designed to create a generation of self-defined men. Today, I'm joined by Dr. Max Draper. Max, it's an absolute pleasure. How are you doing today?
Very well, thank you, Lewis. Thank you very much for having me on. Pleasure to be here.
I'm looking forward to this one a lot, mainly from a personal standpoint, but I'm sure people will get a lot out of it. But as always, Max, in your own words, what makes you a man?
Yeah, when I think about this, I wrote down three things: responsibility, purpose, and sacrifice. And I don't know if it's how I kind of approach this question from my own perspective, which is kind of what helps me on a daily basis is this concept of having a purpose, which often is kind of derived from this idea that you have got a responsibility to yourself and to your loved ones. And then to live a good sort of life as a man or as a human almost, as an adult, I would say, there is a degree of sacrifice. And that's kind of sacrificing, often it's sacrificing the immediate for the longer term outlook. And you can kind of extrapolate that to various aspects of living, health, exercise, looking after yourself, but also you could also argue the responsibility of seeking help if you need it. It's kind of, I don't know, those three words often sort of, I like to use them because I think it sums up a lot of how I look at it really personally. But I know a lot of people will have different opinions on what is a man, what makes a man. But those are the kind of tenets I would think about when I would describe one.
Okay. And do you live by those yourself, or is it what you think is a man?
Yeah, I think it just helps. I think it just helps me define what my own personal, I don't know, the role I have really. And a lot of my role is defined by my family life. I've got two kids. I've got one baby on the way, and a lot of sort of what keeps me sane, but also feeling like I've got a purpose is around that responsibility that I feel to the family. And it's not a negative thing, actually. I think it gives me a role and a good purpose in life. And a lot of that comes from the idea that to be the best dad, to be the best husband, there is a degree of sacrifice, the immediate for the longer term. So even the example of looking after yourself. I mean, I exercise on a regular basis. I try and keep my diet relatively, good, decent. And that's about feeling well now. So you can, you're not irritable, you're not tired and things like that, but also for the future as well. So I can be there to potentially, help with grandkids, etc. So there's all that kind of rolled into how I view my day-to-day existence in a sense.
deferred gratification is a skill in
Yeah.
itself, for sure. So, Max, why don't you tell everyone a little bit about what it is that you do for work?
Yeah, so my primary work, so I work for two different companies, but I think today it's about Alphagenix and men's health and testosterone. So I was a GP for a best part of 10 years, qualified as a doctor about 15 years ago, went through GP training, did the sort of usual standard steps of being a junior doctor. Then I moved up to the Northeast with my wife to do GP training. But it was actually through my own experience of low testosterone and the sort of negative impact that had on me that it kind of inspired me, once I went on testosterone replacement therapy, to learn more and more about the topic. So I've been on testosterone treatment now for, I think it's about 3-4 years. And it was so life-changing to me that it inspired me to delve more into the topic. And through that, I learned more and more about men's health in general, outside of just testosterone and the role it has in a man's health. But it was, completely life-changing for me, career-changing. So basically last year, the end of sort of September 2023, I left general practice to pursue this role full-time. And it's not really a decision I've looked back on, to be honest. It's great work. It can be really kind of life-changing for men when it's appropriately used, testosterone, I mean. So that's how I got here through general practice. But it's been a nice journey of self-discovery as well. Yeah.
I can imagine that there was a few epiphanies along the way when she sort of not found out the truth, but were maybe realised you'd been misled in certain areas for sure, right?
100%. Yeah. I mean, when it came to testosterone for me, for example, like I've been on it, like I say, for about 3 years plus now. And I would say I could have gone on it had I known more, or the wider medical community known more about it, probably 3 years prior to that. And it would have been quite nice to have gone on it earlier in a sense, because low testosterone for me was quite disastrous to my day-to-day existence, sort of mentally and physically, really had an impact on how I was living at the time. And so, that's why I like doing what I do now, because I'm able to educate and pick up testosterone issues at an earlier stage than perhaps going through what I went through personally.
Do you mind if we sort of delve into your personal side?
Yeah.
So what were the symptoms? What were you sort of experiencing before you were on testosterone replacement therapy?
Yeah, so my story began when I was like 29. I was diagnosed with testicular cancer. So I had one testicle removed. So that is obviously a risk factor for developing low testosterone. Mm-hmm. Subsequently, following that, I had viral meningitis, which is, when you get a viral infection that affects the surrounding of your brain and things. So both of those sort of, let's say, insults to my hormonal system ended up with me having, in hindsight, low testosterone, probably about the age of 32, something like that.
Yeah.
Now, I would say that men don't need those disastrous health occurrences to have low testosterone. It just so happens that I had two big risk factors. My symptoms probably started significantly after the viral meningitis. A lot of anxiety. Probably primarily my two main issues were sort of mental health and energy. So fairly chronic exhaustion despite sleeping a lot, and, despite going for regular naps. And mentally, just a very busy brain, a very repetitive brain, a very anxious brain. So my thoughts were kind of jumbled, but also repetitive, recurring. And that just left me feeling pretty defeated, pretty much waking up each day tired, but also then all of a sudden my brain would just kick in and be like, bang, 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 bang. And very poor stress resilience, I would say. So I just couldn't handle things that I normally would handle. So it was quite a rough, particularly 2 years, I would say, prior to going on treatment. Day-to-day slog, ended up going through the whole remit of lifestyle changes. I've always been into sort of exercise. I've always been into a fairly reasonable diet, I would say, not sort of any disastrous habits and things, but I tried to sort of clean up all of that, tried to get as much sleep as possible, did some cognitive behavioral therapy, even was put on antidepressants at one point, but none of it really seemed to make much difference until testosterone therapy was instigated. And that was within weeks quite sort of drastically life-changing.
You touched on those two sort of big diseases that affected your testosterone, but you also said that doesn't necessarily mean that you've got low testosterone. It can just happen a little bit more naturally. Is it at that sort of age anyway? So 32, I'm 32 right now, so it would be, what's the diagnosis?
Yeah, 100%. I mean, so normally sort of low testosterone in the classical sense would be a condition of older men, sort of 50, 60 plus. But for various reasons, not just, big diagnoses like a testicle being removed or a meningitic brain, you can have lower levels earlier than that. And what we're actually seeing nowadays is because the average level in testosterone in society of testosterone in men is dropping, we are seeing younger men with it.
Yeah.
So your natural trend in testosterone would tend to be late 20s, 30, you'll hit, or, in your 20s, you'll hit a peak in your level. And then after about the age of 30, you'll start declining in testosterone, but it's quite a fairly slow decline. You're talking about 1% a year, maybe. Variable between men, depending on how healthy you keep yourself. But generally speaking, that natural, fairly slow decline shouldn't be a massive issue for men. But the problem is nowadays, because the average level that men are getting to is lower, if you imagine if you're starting lower then when you start hitting that decline, I'm seeing guys in their late 30s with low testosterone. I'm seeing guys even in their late 20s with low testosterone. And there's various reasons for that. But yeah, we certainly see a decline. And so we're seeing men younger. It's like the starting point is lower, so they're getting to the low point sooner.
Why is there a decline? What are the reasons?
Yeah, I would say the two main ones are change in lifestyle. So, and obviously increasing rates of obesity. So if there's one way of sort of almost definitively lowering your testosterone level, it's to carry too much body fat. Well, it's actually more so the fat around your organs, so internal fat. So we're seeing high levels of obesity, higher levels of diabetes, so type 2 diabetes. Insulin resistance basically is what we're talking about, and that impacts testosterone production. So that's number one. We're seeing more obesity, which would concurrently you'd see lower average testosterone levels and less activity in the average guy as well.
Yeah.
And on the other side of that, I would say it's environmental factors as well. So we're being exposed to, let's call them unnatural substances that we're exposed to on a regular basis. So we call them endocrine disrupting chemicals, EDCs, or people might know them as phthalates. People know about microplastics, that sort of thing. And it's near on impossible to avoid it. I go by 3 Ps, which is plastics, pesticides, and pollution. And it's hard to completely avoid those as well. But if you imagine our exposure to those over the last 40 years has gone up exponentially, that kind of correlates again with the decline.
Okay, so there isn't really much you can do about avoiding the decline per se, as in it's just what we're subjected to as a society. Is there anything that you would suggest, or is there anything that you tried before testosterone replacement therapy? Is there anything that can sort of boost it or keep it at a fair level whilst we're young, in inverted commas?
Yeah, I mean, 100%. I mean, in terms of maintaining healthy hormones, it generally is about maintaining your overall health. So, number one would be the foundation is getting good night's sleep. I mean, when you sleep it is that recovery phase. And in terms of testosterone production, if you deprive a man of sleep, their testosterone levels reliably go down as well. So number one is sleep. So, people say 6 to, what is your needed amount of sleep can vary between guys, but usually it's somewhere between 7-8 hours, I would say. So sleep's number one. Regular exercise, but, and keeping a good body composition. So the more fat you put on, the more likeliness is that your testosterone level is not going to be where it should be. And then it's about having nutrition. People talk about, you'll see online a lot of testosterone boosters, like supplements and things like that. Ultimately, the main ones really is being not deficient in any micronutrients. Vitamin D is a big one. But if you're generally consuming a good, varied, whole food diet, you're going to cover most of your micronutrients. But, there is a degree of having a healthy intake of certain things like fats and things like that. But it's generally speaking, healthy hormones usually equates to a healthy lifestyle, or healthy lifestyle normally equates to healthy hormones. So it's about looking after yourself in the ways that you kind of know you should be doing anyway. And that kind of usually ticks the hormone box as well.
Yeah. Well, vitamin D this time of year, is there cycles to testosterone as well? Is it seasonal to an extent?
I mean, there's a little bit of research to say that in certain climates, that in like places like the UK and things, you will maybe potentially experience a drop in testosterone over the winter. I think almost everyone in the UK, I say almost everyone, my guys all supplement with vitamin D. I think this day and age, with the fact that most of us don't see as much sun as we would have used to, sort of historically, based on office jobs or just being inside more.
Yeah.
Most of my guys will supplement with at least a reasonable dose of vitamin D. But yeah, vitamin D is one of the boxes to tick when it comes to testosterone for sure. Yeah.
Because obviously I'm sort of aware that you mentioned anxiety and low mood when you had low testosterone. And obviously we see like seasonal depression is obviously quite a common thing, obviously both in men and women. But I was just wondering if potential links between the two?
Yeah, there will be some degree of crossover, because almost as well as it's the problem is, if you look at these graphs, so for example, like how mood can drop in the winter for a lot of the population, male population, if you look at that graph, then you can correlate it with some degree of testosterone decline. Similarly, it's kind of like we're talking about how the rates of mental health among men, young men, are going up quite scarily in society. Well, if you correlate that against the average testosterone level, there's again this graph where the testosterone is going down and the mental health is going up. So there is, and there will be some degree of that being related to hormones. But I suppose with all of these things, there's multiple factors that come into play. It's kind of like in the winter, you're less active, which will impact your mood. You do see less sunlight. Sunlight has direct role in your body in terms of, various roles, not just vitamin D. And it helps your sleep regulation. All of these things come into how someone feels. So it's sometimes difficult to say it's definitely the testosterone, but it'll be part of a potential causative group of things, I suppose, is a way to think about it.
Are there any other sort of serious issues in regards to low testosterone? Are there anything else that's linked to it?
You mean causative of low testosterone, or rather the results of having it?
Results of having it.
Yeah, I mean, if you look at this is the sort of sad thing about the concept that not a lot of doctors, we just don't get that well educated in testosterone through medical school and training. In my experience and a lot of my colleagues' experiences, so the average GP doesn't know too much about testosterone. So yeah, correlations with low testosterone long term, increased rates of heart disease, potentially increased rates of dementia, increased rates of osteoporosis, which is thin bones, increased rates of diabetes, type 2 diabetes, insulin resistance, that sort of thing. Depression, potentially increased rates of depression. So there's lots of deleterious health outcomes associated with having low testosterone, which makes sense when you think about it. It's a hormonal deficiency. If you have a hormonal deficiency, your body's not working as well as it should be. So It kind of makes sense that things aren't going to long-term be as good for you if it stays like that.
Why do you think you're not educated on it as much? I imagine you're educated more on things like the menopause. Is that fair to say? Why do you think there's a disparity there?
Yeah, this is the sort of the golden question, which I'm not quite sure of. I suspect it's because testosterone in the 80s and 90s got associated with anabolic abuse, so steroids.
Yeah.
So that was kind of frowned upon by the medical world. So it kind of got lumped in with misuse and anabolic steroids. So that kind of gave it a bit of a negative picture. Also, there's been a couple of studies done at certain sort of major points in medical history, which really dampened the enthusiasm for testosterone. One of which was kind of this concern that testosterone caused prostate cancer. Okay. So that kind of put a bullet in the concept of replacing deficient levels. And the other one was heart disease. So like I said, the modern actual viewpoint is that low testosterone is a risk factor for getting, heart attacks, heart disease, that sort of thing. But, at certain points, there's been a fear that testosterone treatment increased your risk of heart disease. And again, the modern data is it doesn't, it's neutral. I personally think if you do good TRT alongside healthy living, it's better than having low testosterone for your heart outcomes. But there's been various things. It's been like the association with it being a performance enhancing drug, abused by bodybuilders, etc. And there's been various studies at certain points which have kind of dampened the enthusiasm. And the problem in medicine is that when like rhetoric or a big message gets put out there, it takes years for that to correct. It's not as dynamic as one would hope to filter down. So as soon as it was kind of like, if you asked your GP, does testosterone replacement treatment increase your chance of prostate cancer? You'd probably have a high chance that they would say yes, even though the data says it doesn't now. But that's because minds take a long time to change. And the problem with GPs and things, my wife's a GP, I was a GP, so I know the trouble or the hardship of the job is that you're very busy, in terms of you're very busy just getting by. So maybe researching the most up-to-date opinion is not top list of the priority. Most of the time, it's just trying to see enough people to get through the day.
Yeah, I guess there's a fine balance between cure and I guess I'm trying to think more how I'm trying to word this, but yeah, cure rather than my mind's gone completely blank. Essentially, a GP's role is to diagnose and give a cure, right? It's not a case of going into the nitty gritty of what's going on in your body and what might be each outcome.
100%. Well, it's like I always say to people, they've got sort of like 8, 10, maybe 12 minutes. So the nature of how we're taught is very much so symptom diagnosis, solution, which is often a prescription. That's not really, when I have the pleasure of time and things like that with people, it's not so much a rushed endeavor, which, it's just part and parcel of seeing sort of 40 people a day, which is what a lot of GPs will doing, or at least 30. You've got to have something fast. Whereas things like testosterone, things like, I've listening to your podcast, that sort of more in-depth, holistic approach to medicine, that takes time. What's your diet like? What's your lifestyle? How much exercise are you doing? How much sleep? Have you thought about lifting weights? Have you thought about going for a jog, etc., etc.? That is not a quick in and out consultation. That's like an in-depth chat.
Yeah, that's a lifestyle change, right? That's not I think I've heard this, that modern medicine is not really designed for these sort of ailments. It's more literally, if you have something, we can get rid of it and then you can go away. But if we're looking at you as a person and your lifestyle and what might happen to you in the future, that's sort of on you with the way that medicine's sort of delivered to the world.
It's not yet. I mean, it's like you look at the guidelines for things like high blood pressure, for example, or you look at the guidelines for type 2 diabetes. It will mention, like, first line is diet and lifestyle. And it's one sentence, and it's like basically not ignored, but it's very much so like, oh, you should lose weight. Next is take this medication for your diabetes or take this medication for your blood pressure. Whereas realistically, if you fixated on that lifestyle bit and really endeavored on a change, you may still need medication, but you may well not need medications. And I think that's how I like to look at a lot of things, is kind of if a guy comes to me and, we're talking about the testosterone, but they might have high blood pressure. It's like, well, if you lost 10 kilograms, you did regular cardio, you got your sleep in order, etc., etc. And it's not like as brief as that, but we go into the detail. You can actually reverse a lot of this stuff going on. But that's because I always say I have the luxury of time, basically.
Yeah, that's the difference, isn't it? It's like, it's working on yourself needs time and it needs a more tailored approach, whereas medicine is essentially one size fits all, which is conversations that I've had around sort of antidepressants and things like that. That's just the way that's dealt with. If you go to a doctor and you tell them that you're depressed and you tick all the boxes, they will prescribe you with antidepressants, whether you think that's the right decision or not. You've gone to the doctor, so you're going to get that answer. That's just how that flowchart works. So yeah, if you want something different, you're going to have to go find it somewhere else or work on it yourself in a different way. That's
Fortunately, there is a lot of avenues to go down now online and things like that. Like a lot of my learnings about lifestyle medicine, because again, not something you're taught in any great deep depth at medical school or training as a doctor, which might surprise people. But like nutrition was not a big part of your training. How much protein should someone eat? How many carbs? How many fats? Where's the best source? And even that's flipped on its head over the last few years. I mean, it used to be all about carbohydrate, refined grains, all of this stuff. Whereas now I think a lot of people are leaning on more of a kind of, not carnivore, but more of a paleo type diet, actually avoid the processed crap. And usually that puts you in the right direction. But yeah, that's all been sort of self-taught as well, and partly because I quite like bodybuilding and I'm quite into training and things. So, a lot of the bodybuilding stuff about high protein intake, etc., is actually quite applicable to a lot of people out there, because we want to hold on to that muscle. We want to be able to build muscle and keep it as we get older. So I've, again, it's one of those things in medicine where it's not really delved into, I would say. On average, can't speak for everybody, but in general speaking.
Yeah, not speaking for everyone. I think one of my rule of thumbs is if I can't read the ingredient, list on the back because it's either A, so long, or B, it's full of words that I've never seen in my life, then I will try my best not to eat it. I do not claim to be perfect, but I will try my best not to eat it. So yeah, there's definitely easier switches for that. You mentioned bodybuilding, you've mentioned testosterone, the negative sort of effects on that. Can you sort of talk to me a little bit about the difference to that stereotype, which is, well, everyone who's a bodybuilder takes steroids and testosterone, and that's why it's harmful, and the amount that you're looking to prescribe to someone who may be doing TRT?
Yeah, I mean, absolutely. I mean, I suppose to be fair, someone on testosterone replacement therapy in general will have a anabolic edge to someone who is not on testosterone replacement therapy. And the two main reasons for that is if you're on TRT compared to even a guy who's natural and has good levels of testosterone, your level of testosterone is it's pretty consistent because you're injecting it or you're taking basically an exogenous source. So you're taking something and putting it in your body. So it's determined by you actually sticking to your treatment. So that's number one. Number two is it doesn't vary if you get ill, if you lack a night's sleep, if you're stressed out. Your testosterone level will be constantly good if you're on replacement. So you do have an edge compared to natural people. So there is a performance enhancing effect of TRT. It's kind of like a side effect because it's not the aim of treatment. The aim of treatment is to correct how you feel from low testosterone, but it does give you a edge simply by the very nature of the treatment. But compared to kind of like people using anabolic steroids and things, and I deal with some guys in that world from my other job, which is for a company that does private bloods and private tests on anybody who requests them, really, and we kind of delve into the results. It's called Atlas Laboratories. So I will see what people are taking, and you're talking about like a steroid user would not really take testosterone at least 3, 4, 5 times plus what a TRT dose is. So what someone takes for replacement will generally be about a fifth or less than what someone uses for bodybuilding purposes. So there's a huge difference in dose, simply because if you're a bodybuilder, professional bodybuilder, or wanting to take anabolic steroids, the dose, a TRT dose, is not really going to make much difference compared to just doing it naturally. So in order to get the anabolism, like extreme anabolism that they're looking for, so muscle gain, they're starting at, at least 300 milligrams a week, whereas a TRT dose is usually about 100, but it does go up to like, including the other agents they'll use, if you sort of like add them all together, a gram a week. So you're talking about 10 times what a TRT dose is plus, really.
Which is a lot more, right?
Yes, yeah. Well, the thing about testosterone is, and this gets a bit science and nerdy, but basically TRT aims to satisfy the receptors for the hormone in your body, and they get satisfied at a certain level. Now, if you take more and more, those receptors are satisfied. So it doesn't do anything to how mentally well you feel or how sexually well you function, etc. But your muscles work in a different way. So if you take more and more, you will get your muscles will still keep responding, whereas the rest of your body doesn't carry on getting better and better and better in how you feel, your mood, etc., etc. So that's why TRT doesn't need to be anywhere near those doses, because guys, we're aiming for them to feel better. And you don't need that kind of 500 milligrams a week to get there. So that's the kind of difference, if you see what I mean. But it's interesting because the muscle responds differently to the rest of the body, in essence, in a way to think about it.
Okay, so like, as anabolic, you hear about the word anabolic state. So that's the idea. You get a little bit of that from TRT, but what bodybuilders are looking for is more, so they take more.
Yeah, exactly. Yeah, I mean, the body compositions from TRT, you do get benefits to it, especially compared to having low testosterone. But that doesn't really become visually apparent until 6 months, a year down the line, and you get that compounding effect over time because you're in a slightly better anabolic state on TRT compared to before when you had low testosterone. So it kind of compounds over the years. but you're not using anabolic steroids to wait a year, 2, 3 down the line to get some small changes. You're looking for big changes over a period of like a few months, 6 weeks, 8 weeks,
Yeah. Okay. Cool. So you mentioned the other side of what it is that you do, the testing and the bloods and that side of things. Obviously, you can feel in yourself your mood if you're tired and all of these things. But when it comes to testosterone and its levels, you have to go and get tests to understand where you're at. Right? There's no secret to working out what your number is without doing these tests.
Yeah. I mean, there's a couple of questionnaires that you can do. One is the aging male score. One is an Adams score, which people can Google and look up online. And they're quite quick questionnaires, like tick box exercises. And if you score quite highly on those, there's a reasonable chance you might have a testosterone problem. But at the end of the day, I get asked this quite a lot. They're like, on social media and things, it's kind of like, I've got this, I'm tired all the time. Do you think my testosterone might be low? And it's kind of like, well, just get your bloods done and look at various causes of tiredness, like thyroid, testosterone, blood count, looking for anemia, etc., etc. So yeah, short answer is you basically need blood tests. Yeah.
Do you think that that's something that you should take seriously as you age as a man? Like checking in on yourself, like doing a diagnostic?
Oh yeah, I recommend to a lot of my guys to, even if we don't go down the route of TRT, so I'll often recommend, depending on age, like if you're in your 30s, every year, every other year, take a look under the hood, see what's happening with your hormones, but also your general health. I think it's a great idea. I think it's a really good way of it's part of this whole picture of optimizing your health now and for the future. And you kind of don't know what you don't know. If you're feeling great from a testosterone perspective, you don't need to get it checked, because at the end of the day, if someone comes to me and even if their testosterone levels don't look very good, but they feel great, well, we're not really going to do anything about it, because what's the point in going on testosterone treatment if you already feel great? You're not gaining anything. You're just committing to a treatment for the long term that's not really shifting your needle. But yeah, I think it's a really good idea to take a look under the hood every so often. As you get older, you probably want to look at that more regularly. But yeah, I think once you start hitting your 30s, it's a good idea to occasionally have a look and see what's going on. Part of it is that you can get, what I quite like about it is, for guys, it can give us something, because guys like numbers, they like things on paper where they can see, oh yeah, I am drinking too much because, one of my liver enzymes raised and my cholesterol's distorted. So you can kind of point out to, it's like a feedback mechanism. It's kind of like, look, dude, like you're becoming pre-diabetic here. You might want to start hitting the gym and lose a little bit of weight and things. So it's kind of, it gives you an objective marker to tell you what's going on about your health right now and potentially prevent stuff in the future.
Men are famous for not going to doctors, right? And trying to do it themselves. But this is a good middle ground to start with, for sure. Like, just get some data and make a decision based off that.
Yeah, exactly. It's kind of just, if you have more information there, a lot of guys, from their blood work, will end up, kicking the regular, the couple of beers each night. They'll end up, instead of buying a sandwich or something when they're out, they'll end up cooking the night before and taking it to work. All of these, these micro habits can be shifted to a better place for their health. And sometimes just having that on paper really inspires that change.
You mentioned right at the beginning, like about being able to help with like the grandkids and stuff. And this is one thing that I don't have any kids, but I was asked if I would ever have kids. And my answer was, I want grandkids, which is I don't know, someone would look into that from a psychology point of view as me being weird. But the reason that the other thing is that I'm in my 30s and most of my friends' dads would have had their kids in their 20s and been able to run around with them. So for me, that's my motivation. But if you've got kids and you've got grandkids, you need to find other motivations to change habits, I guess.
Mm-hmm. Yeah. I mean, I think my daughter's now 7, so I had her when I was 30. My second one I was 32, and now I'm having one when I'm going to be 38. So I'm kind of getting on it. I think this will be the last one as such. But yeah, you do sort of start doing the maths and think, well, with this baby, I'm going to be in my 50s by the time they're kind of like an 18-year-old ready to go to university or whatever. It's kind of like, I am getting on a little bit. You just try and start doing the calculations. And that's part of the encouragement of keeping fit and active and things, I suppose, is the fact that you want to be able to be functional when you're in your 50s, 60s, 70s. I'm not, so a lot of people in my space, call it this health optimization space. I do a little bit of longevity work with people as well, is they kind of put a number and say, I want to live till I'm, 100, 110. I have no interest in particularly living years and years and years. I just want to kind of be functional while I'm alive, if you see what I mean, as long as possible, to be fair.
Well, that's the goal, right? I don't think I want to be 110 with no faculties. I think it would be a waste of space, in my opinion. I much prefer to live to 72 and the day I die is I was on a bike. Like that would be quite nice rather than ever going through something like that. So yeah, it's that sort of links to another thing that I talk about, which is like people have these weird goals that they've just heard from other people, which is like, for example, I need to earn £100,000 a year. But it's like, well, what are you actually doing with that? And like, I need to live to 100. Well, why? What's your goal at 100? Like, there's other things to just the outcome, which is another conversation for sure. When it comes to testosterone levels, and we've done our sort of diagnostic check and we've got our numbers, what should people be looking out for, and when should they be looking at maybe making a conversation to look at TRT as an option?
Yeah, so there's kind of like three different ways of looking at a testosterone level in the sort of modern medical world. One is that, so an endocrinologist, not speaking for all endocrinologists, but they're the kind of hormone people of the NHS, let's say. Generally speaking, their guidelines will say if you're outside of the normal range that the lab gives you, which there's some age adjustment of some of the ranges, and these will vary in the country. There's different ranges in different parts of the country, bizarrely enough. But generally, that'll be like kind of a total testosterone of below 8, let's say 8.5. Then there's something called the BSSM, or the British Society of Sexual Medicine guideline in the UK, which says a total testosterone of below 12 might be a deficiency. And then kind of the other hand of it is you want to look at free testosterone as well. So when you have testosterone in your blood, the majority of it is not deemed to be free. Most of it's bound to proteins in the blood. So the free testosterone is also a significant number because that's the kind of the most biologically active form of the hormone. And generally it's about 2% is actually free. So you want to look at both the total and the free testosterone, because you can have a normal total and have a lack of free testosterone for various reasons. It's to do with like the binding protein numbers and things. But I would say if your total testosterone is below 15, you want to have a chat with someone who kind of knows about this stuff and can work on, what's the best outcome for you. Or if your free testosterone is kind of, and I'm just giving them, people will understand if they've got their sort of results in front of them. But the British Society of Sexual Medicine guideline is below 0.225 is the number they give. I say if it's below 0.3, you're definitely suboptimal. Worth a chat, see if there's something we can do to increase those levels, whether, i.e. obviously the best outcome is you increase it naturally, but certainly if it's deficient below outside of the normal range, you need to speak to someone about it. But below 12 or below 0.225, that's certainly could be a deficiency, and you've got to look at symptoms as well. So if someone feels great, like I said, and their levels are kind of suboptimal, but they feel great, they're probably sensitive to the hormone, which means their body doesn't need much. It's all to do with how sensitive your receptors are. But the converse of that is you can have a level of 14 and you might feel like crap, in which case I would want to speak to you about what's going on and whether it is a hormonal issue, whether it's something else or what we need to do, basically. But those are kind of a rough level. 12, 0.225, kind of that ballpark. You want to have a chat with someone. But it won't necessarily be your GP because they're not always that, again, like I said, there's that sort of knowledge gap sometimes. You know, I know you had Dr. Rainbow on, and he's obviously done a lot of research into this space.
Yeah.
There is some in the UK who've done, you know, more than what they're originally trained to learn about it. They've done their own research on it.
Personal interest, though, right? I guess it depends what they're interested in, for sure. That's going to be a big part of it. I've had Dr. Edward Rainbow and Ryan Park, who also talks a lot about testosterone, but he never claims to be, but he's not a medical profession, but he obviously knows a lot about the space and everything that goes with that, for sure. I guess on that and that sort of interest, and we spoke about it briefly, that there is a lack of it in the NHS, but there's also a lack of it in the male population as well. And I look back to my sort of sex education, if you will, when I was like 11, and it was literally like consent, condom, STIs, see you later. Do you think there should be a shift towards a conversation around testosterone, what it means for boys as they grow up, what the peak looks like, what it looks like from an after that as well?
Yeah, I mean, it'd be certainly useful. I think, fortunately, in the world of podcasts, Joe Rogan, all of these people, I think people are being exposed to more sort of data about, it's not necessarily functional medicine, but more of a wide plethora of medical information. So people are becoming more aware of testosterone therapy. A lot of guys who come to see me have heard about it from podcasts and things. You know, they'll be like, I heard, you know, Lewis talking to Ryan, and it made me think, have I got an issue here? So there is definitely increasing levels of knowledge of the area in the wider medical community, purely based on this whole social media podcasting world, which is useful. Sometimes it can send you awry because some of the information out there is not always the best quality, but it's definitely inspiring more conversations about it. A lot of guys as well, with the world of TRT, for example, a lot of patients I see, their friends are on it. So their friends are saying, oh my God, this changed my life. I went from being, you know, low in mood, low energy, to now I feel like I can, you know, hit the gym again, work better, and my concentration's better. So a lot of it's spread by word of mouth as well. So it's definitely improving, I think. We're a little bit behind America, which has kind of gone the other way, where there's a testosterone clinic on every corner.
Okay.
And they're not always you know, I've got basically most of my friends in this space are American. So they have the other end of the equation, almost in some areas, I should say, because it's obviously such a big country. But they have an issue with quantity. No, they have an issue with quality rather than quantity. We have an issue with quantity, not necessarily quality, because not many clinics do this and do it, you know. Whereas in the US, you can walk into a bloody clinic and get a testosterone injection pretty easily, from what I gather. Whereas they're not always the best providers, I should say. So it's kind of, but we tend to follow America just 10, 15 years behind, if you see what I mean. So I think it is spreading over here. And obviously a lot of our social media, a lot of our podcasts are American influence. So it does spill over.
I just find the whole thing fascinating. I mean, there's other things that I've recently learned around testosterone spikes and how you basically get a new one every 15 minutes. I just feel like information like this would be really useful to like an 18-year-old or a 16-year-old or a 15-year-old that's going through quite a lot of testosterone being sort of around their body. It's coming, but I just didn't know whether you felt there should be a mainstream narrative put into schools or further education, or whether it was just going to be through social influence that this message got out.
Yeah, I thought about this a lot. I think it'd be really handy because I think it's similar to you. I really don't recall any teaching about my own physiology when I was at school. And I think it would be handy for people if they just got a baseline understanding of, you know, I'm not talking about in-depth knowledge, but a basic understanding of your hormones. What do the hormones do? Why are they needed? You know, your thyroid hormone, your sex hormones, what is it about sugar and sugar control? You know, keep looking after your organ health. So all of these things, because it's quite, you know, you could talk about one lesson would cover one aspect of these things. It would be handy because I think if you're educated, it's like I was saying about like showing men their blood results, is if you're educated in an area and you've got some information, you're more likely to potentially look after these systems. It's kind of like, look after yourself, because it will keep, most likely that's the way you're going to keep healthy levels of testosterone, which is important for X, Y, and Z. So yeah, there's definitely an element of, it would be great if we had basic physiology to understanding at school. That would be a nice start.
I think so too. I think it's something that's missing. I don't know enough. I'm still learning it now, which, like I say, at 32, is that the right time to be learning this? Probably not. I've gone through quite a lot of my testosterone journey and my hormone journey, if you will. So yeah, I think if I knew this earlier, I just feel like I'd have dealt with other situations in life better, because I would have had an understanding. Because, like, to use the female side of this, they obviously have conversations around periods and what that looks like and the hormone imbalance from that side of things. But we have hormones too. We just don't bleed once a month. Like, it's just a different way that it's sort of done, for sure. Looking at
women. Sorry. I think women are more aware of their hormones and the important role they have because of that cycle. So you can speak to women who, many women don't always have changes in their mood and their fluid retention and things like that around their period cycle, but many do. So they will understand that, hey, wait a minute, as my hormones fluctuate during the month, I feel different mentally, physically, libido-wise, sort of. So they are much more tuned into the fact that the hormones affect how we feel and function. Whereas as men, we don't have that cycle to understand the difference between ovulation, between when you're on your period, between X, Y, and Z. So they have a much earlier understanding of the role of hormones. Even if they don't actually associate with hormones, they just know their cycle changes how they feel. The other thing is, obviously, they're put on contraceptives and things like that, which again is hormonal. So they get introduced to this world of hormones earlier, and then they hear their mum talking about perimenopause and menopause. So again, they get information about, oh, my mum's having hot flushes because her hormones are changing. Whereas as men, it's kind of like day to day is not variable based on at least to us, it's not based on our hormones. It's just based on, oh, we didn't sleep well last night. That sort of thing. So we never associate with how we feel with our hormones, whereas obviously there is a crossover massively.
Yeah, I mean, we're not here to solve the education crisis and problems, or the NHS, which we've also sort of touched on as well. But looking at like the men's space, longevity space, this influx of bettering yourself, what do you think is doing really well in the space, and what do you want to see more of in the future?
I don't know if it's doing well, I think it's doing better, and I think it's courtesy of people like yourself talking about it. But I think men's mental health, at least in this kind of arena of podcasts and things like that, is getting more attention because, you've spoken before about like suicide rates in young men. It's horrific. And, the fact that men aren't always sort of willing or as often able to go and seek out help. So I think that is getting more attention, maybe not necessarily in the widespread or the sort of corporate media, let's call it, but it's getting more attention in sort of more of the online space. I think, and again, this is happening to an extent, but my big thing is the link between physiological health, so physical health, let's call it, how well your body's functioning, and psychology and mental health probably needs a little bit more attention, or at least explaining, because like we're talking about the way that hormones affect your mental health, as does all sorts of medical conditions, whether it be insulin resistance, whether it be having an excess amount of internal fat. All of these things impair how well our bodies work, and our brain is part of our body. So I think we often don't link the fact that someone is physically not in a great place health-wise with the fact that maybe they're mentally not that great because of that. And there's that problem with that vicious cycle that you get into where you're unhealthy, so you don't feel well physically or mentally, and that promotes more unhealthy behavior and so on and so on. It kind of gets into that vicious cycle. So it's kind of like associating the fact that, yes, there are psychological issues, but also some mental health problems are at least linked to some degree with physical health, and that link is often kind of missed because we kind of treat mental health as a separate thing from physical health, whereas really they're intertwined. And I think just that awareness of it, that's why we talk about when you made yourself, improved your overall health. It was about, I remember listening and you going for walks and you were looking after your diet, your sleep and things, and mentally that helped how you felt. And that's because there's that crossover. It's not just, it makes you feel more confident because you're achieving something. It's actually physiological as well.
That's actually a really nice thought process. That's probably, I've spoken to Professor Mark Ord and Rebecca Owens, also a professor. They talked about that's what men's mental health needs, a psychological and a physiological approach, which is rare to hear, but that's twice I've heard it now. So thank you. I think it should be said. I think more people should look at that, because I think that is, now you say it, that's definitely something that I do also agree is missing a lot. Max, it's been an absolute pleasure. I've enjoyed every minute and I would love to continue the conversation. But if people have enjoyed what they've heard and want to find out more and want to look at tests and want to look at their TRT, let them know where they can find you and reach out to you.
Yeah, so it's I'm not very IT literate, but I've got an Instagram account at Dr. Max Draper. I think it's Dr._Max_Draper. And there's at Alphagenix, there's at Atlas Laboratories. And if you just go to their web pages, alphagenix.co.uk, atlaslaboratories.co.uk. I always think I say laboratories really poshly. It sounds really posh. Those are the companies that I do work for, and there's like sort of contact us forms on there, and the teams that are there are not sort of pushy teams. They're very pleasant people to speak to. They're on to me all the time about asking queries and quandaries. So if you're unsure even about getting a blood test, you can always run it past them and they'll be able to point you in the right direction.